It's a warm welcome here in our studio in Serekunda. This is Star TV News and I am Dada Cham. In the headlines tonight, additional 5 people in quarantine reveals permanent secretary at the Ministry of Health. Gambia biggest GSM operator Africell to pay health frontliners for 3 months in the fight against COVID-19. United Nations Population Fund donates motorcycles to the Ministry of Health in their efforts to fight COVID-19. On the international scene, IMF says Nigerian economy to shrink by 3.4%. Trump said virus curbs to be lifted in states as cases peak. Denmark eases restriction to health virus for schools. Those were the headlines and now the news in details. The permanent secretary at the Ministry of Health on Thursday informed journalists at a press briefing in Banjul that there are additional 5 people under quarantine. Mariama Dem sent us this report.
The permanent secretary at the Ministry of Health, Dr. Mustafa Abite, highlighted the current situation in the Gambia and the global front. He also set light on the issue of logistics and security.
So all 5 new laboratory test results received from the Medical Research Council laboratory are all negative. 5 additional people are taken into quarantine. Of these newly quarantined, 4 sneaked into the country and 1 was close contact of one of the recently confirmed cases. So currently, the country has 6 active cases and 1 probable case. Globally, since 31st December 2019 and as of 14 April 2020, a total of 2,004,991 cases of COVID-19 have been reported. Of these, 126,830 deaths were registered and 485,830 recovered from the disease. Senegal has recorded 299 confirmed cases, 183 recoveries, and 2 deaths. Currently, we have 61 people on quarantine in one of the hotels in the Greater Banjul area. A total of 298 cases were conducted and 9 were positive. 254 people have completed quarantine. 241 contacts have been traced and 310 people completed follow-ups. So updates on the coordination, case management, logistics and security, laboratory and surveillance, as well as risk communication and community engagement are the following. So daily coordination meetings ongoing at both the strategic and the technical levels. Decision has been reached to test all persons in quarantine before discharge. For laboratory and surveillance, regular follow-ups of all persons discharged from the quarantine are ongoing. And in terms of case management, psychosocial support officers have been redeployed to the regional rapid response team to strengthen operations. Public health facilities in Western 1 and 2 and 3 private facilities, Medicare, Afrimed and Buffalo, received trainings on IPCs and case management over the weekend. In the area of logistics, 500 gallons of bleach, 500 soap powder, 1,500 laundry soap bars, 3,200 hand washing liquid soap, 140 washing pans and waste chambers, and 25 megaphones were received.
Dr. Bite indicated that the Ministry of Health will intensify the quarantine as a matter of urgency and strengthen surveillance in all regions, especially in some villages within the Upper River region, which bordered with Senegal. He also calls on the general public to be calling in order to inquire about the virus on the toll-free line 1025. Reporting for Star TV, I am Modu Elbaji.
In their quits to combat the COVID-19 global pandemic, Gambia biggest GSM operator Africell has took it upon themselves to donate $12 million to the Gambian's health sector, in which health frontliners will be earning $2,000 for 3 months. Mudo Baji files in this report.
Africell Gambia has injected $12 million in the country's health sector in order to combat the COVID-19 pandemic. However, these funds will be distributed over the next 3 months through a service they call as AfriMoney to frontline health workers in order to support themselves during the course of the novel coronavirus pandemic. The public relations officer at the Edward Francis Small Teaching Hospital, Keba Sane, outlined his perspective on the laudable initiative Africell has bestowed on the country's health care system. Piero Sane further elaborated on the modalities used by the hospital in downsizing their staffs.
Recognizing the fact that this is not a donation just subjected to the leadership of the hospital, but across the board, I think this will encourage and motivate our staff and make them believe that whatever they're embarking on, delivering the necessary medical care service is of very important matter to the Gambian people, and particularly to the company that has donated so much to us. This is not the first time we're dealing with Africell. Africell has always been there. And this one, I think this is a great initiative, because this period will meet at a time we're entering Ramadan. So these people having this little money added to their monthly income, I think would benefit them tremendously. Yes.
Okay, have you subjected your staff to anything like a lay down of staff? So did this COVID-19 give back to such at your institution?
Yes, we do have. We reduce our staff capacity. You know, those people who were coming every day, the offices are reduced. Some of them will come twice a week. Some will come 3 times a week, depending on the importance of their jobs. And so, yes, we adhere to the rules and regulations set forth by the government, and that is to reduce the number of staff coming to Edward Francis Small Teaching Hospital.
Are those who are sent home, are they gaining any benefit out of it? Have you given them something to stay home with?
No, we are sending them home, not because we are giving them anything extra for staying at home. We are making them stay at home so as to decongest the apartments or the rooms or the wards, okay? But that means what? They will, despite the fact that they are coming on twice a week shift or 3 times a week, depending on their service, we never cut their salaries. They will have their salaries running.
Doctors in public hospitals are to receive $2,000 per month, while nurses and other frontliners are to receive $1,000. Moreover, Africell has provided free SIM cards for health workers in order for them to access the AfriMoney service. Africell's media officer, Musa Sise, revealed on how they came up with this commendable initiative.
I mean, this thing came about and an in-house thought as to how best we can make an impact towards the COVID-19 fight, because this is everyone's business. I mean, what happened was that management, we thought how best, because we saw and realized that there are still, money is being raised without even thinking about how are we going to spend this money in the fight against the COVID-19. But we at Africell thought about, you know what, we think that the people who matter very much in this campaign are the men and women who are trying to keep us safe, who are trying to be our keepers, who are on the front line, be the doctors, the nurses, the janitors, the ambulance drivers, continuously trying to make sure that we are safe and we cannot be infected. And that is why when we start, we realized that, you know what, let's go for the health workers, because this is, if it is a war, they are the soldiers. That's how. We didn't care about how many doctors, nurses we had. We just permutated these numbers in terms of how much we can add to their earnings and to see what kind of impact it's going to make. And that's how we came to reach this conclusion.
The money will be distributed among nurses and doctors within the country. Maria Madem, reporting for Star TV News.
Some concerned Gambian citizens earlier yesterday said their views on the recent donation of $12 million made by AfriCell to the Gambian government to help fight against the COVID-19 pandemic, and most of them seem not to be very happy with funds going into the government's hands. Jacqueline Colley was out in the street and she now reports.
Following the recent donations of $12 million made by AfriCell to the government of the Gambia, Modlamin Jassi, a concerned citizen, opined that AfriCell should have used the cash to provide provisions that will be shared among the less privileged, starting from the provinces, considering the fact that most of the people feed from hand to mouth. He added that since the lockdown, things have not been easy because every social need has increased from transportation to food and other vital necessities. Mr. Jassi highlighted that reducing the internet service for their customers too will be a great deal for the people, because the customers are not earning much during these trying times, and the internet service in the Gambia is expensive, especially during the lockdown period. He said the government is not in any way helping the people, considering that most of the people are now jobless because of the pandemic coronavirus, adding that the government should imitate other states that are helping their people with food provisions to help reduce their worries during the lockdown period. Alaji Jawa said the virus is a scary one, but the world will overcome it if the prevention methods are well followed by the people. He said the government should now use these funds that various sectors like AfriCell donates to help feed the people, because many are suffering in these trying times due to the lockdown. According to him, the government is not helping its people in any way. He said they should put up measures to the people, especially the less privileged who cannot afford 3 square meals per day, and it has become harder for them during these times. Jacqueline Colley, reporting for Star TV News.
In their efforts to combat the COVID-19 global pandemic in the Gambia, the United Nations Population Fund on Wednesday donated motorcycles to the Minister of Health in Banjul. The donated motorbikes are meant to enhance the mobility challenges faced by a contact tracing team and health workers in the course of their duties. Omar Job reports.
The Minister of Health, Dr. Amadou Lamin Samate, expresses gratitude to the UNFPA as he outlined the importance of this donation to his ministry.
Bikes goes a very, very long way in enhancing our ability to do contact tracing during this COVID time. Contact tracing is one of the most important activities of the management of any outbreak, the management of any pandemic. Because if the contacts are not traced and given adequate care, the disease is likely to spread into the communities like wildfire. So this will enhance the contact tracing team's ability to go into all the corners of this country, to be able to talk to the patients, to be able to talk to their family members, to be able to talk to those people, individuals at risk. So these motorbikes, and gauging by their quality, we are happy that you did a whole lot of work to be able to get the best in the market for this. We want to use this opportunity to reassure the Gambians, the entire country, that the ministry, together with its partners, UNFPA and other partners, are working very, very hard to contain COVID-19 disease in this country. We can see this is a gesture to demonstrate that that together we can make a difference. The people of this country, we also appeal to you to maintain the social distancing, because we keep on saying, for communicable diseases, a disease that moves from one person to the other, when the infectious agent moves from the infected person to the uninfected person. So if there is a breakdown of that communication, that link, then that disease will not affect the uninfected person. This is how simple it is to understand. So the social distancing that we've been preaching day in and day out is very, very important. It has been working elsewhere, and we wish to use this opportunity again to appeal to the Gambians. Government is not saying this just for the purpose of saying it. But because government knows that this is what is required and this is what is good for the protection of the citizenry. Once again, we say a big thank you to the UNFPA under the leadership of Mr. Kunle himself. UNFPA is a real partner of the people of this country.
Dr. Samate added that the motorbikes will go a long way in easing the issues of transportation in his ministry. The United Nations Population Fund country representative, Colonel Adeni, revealed the idea behind the donation.
Where COVID-19 affects the root health of the people of the world, not only in the Gambia, but also the world. What are we doing to do this? You must understand that now the government is working to ensure that they limit the rate of infection of COVID-19. What do we mean by that? We need to make sure that the Gambian population is protected and that less people get infected in COVID-19, because by doing that, less people will ultimately die. We want to ensure that we limit that. So UNFPA is supporting the Gambia by ensuring these motorcycles are specifically going to go, as the Honorable Minister himself said, for contact tracing people who are infected, and community surveillance. And what does that basically mean? That you want to reduce people who are infected from contacting or touching other people so that they do not get infected. These motorcycles will help to work in the communities, get reports, and bring those cases out. That is what has happened.
He reveals that UNFPA will continue to provide assistance in the Gambia in order to combat the global pandemic. In a similar engagement, the Gambia Pharmaceutical Society donated sanitizers to the Health Ministry as part of their effort in the fight against COVID-19. Reporting for Star TV, I am Umar Job.
And now the news beyond our borders. The International Monetary Fund says Nigerian economy is expected to shrink by 3.4% this year, and Africa's largest economy could face a recession lasting until 2021. Oil-rich Nigeria has been hit by the plunge in the demand for energy set off by the global lockdown against COVID-19, and the country's jobless rate, already at 23%, is expected to climb even higher. Ajazila Ahmed Idris report from Abuja.
The global COVID-19 pandemic is taking a human and economic toll on Nigeria. Its main resource is oil. Demand and the market price is falling worldwide. Adding to the crisis, a dispute between major producers, Saudi Arabia and Russia, which has driven prices to their lowest level in nearly 2 decades. Although world producers have agreed to cut production in order to show up prices, there's been no significant rises yet.
It's not going to be easy for us. But what the president has done, what the president told us, is he doesn't want development projects to suffer. We've taken a lot of preemptive steps, and we are very confident that we'll be shielded from some of these losses that are being expected.
Nigeria cut its daily output from 2.1 million barrels to 1.8 million before the oil producers meeting a few days ago. And the new agreement has forced another cut in production by a further 417,000 barrels a day. Economists say this is leading to plant closures and job losses, which they estimate to be between 15% and 30% for now.
Some companies that are paying half salary right now, nobody knows whether those employees will begin to earn their full salary at the end of the pandemic or continue to earn half salary for some months, or it could be up to a year.
Experts say even for those able to keep their jobs, there are no guarantees of doing that for long. Nigeria's recession is projected to continue into next year, though at a slower rate. Representatives of organized labor here are concerned.
Any threat to jobs would be additional injury to too many, because already there is injury to lives, and then you want to have injury to livelihood. Labor will not tolerate this at all.
The National Bureau of Statistics report of 2019 said Nigeria had 23% unemployment in 2018. But one official admitted that the number could top 33% this year, and that was even before the COVID-19 pandemic and a sharp decline in oil demand and pricing. The Nigerian government is cutting its 2020 budget estimates by nearly 40%, with negative implications on financing development and job creation. A report from the World Bank predicts Africa's economy will lose between $37 to $79 billion in output this year. Nigeria in particular is expected to account for a substantial part of that loss. More bad news for a country which only 2 years ago emerged from its worst recession since 1987. Ahmed Idris, Al Jazeera, Abuja.
President Donald Trump has declared that COVID-19 restriction could be lifted in up to 30 U.S. states by the beginning of next month. He said he could or will talk to the governors on Thursday about the move as infections in the United States had hit a peak. The U.S. has more than 630,000 cases of infection and more than 30,900 people have died from the virus. Al Jazeera Mike Hanna reports.
These daily news briefings are purportedly to keep the nation informed about the battle against the coronavirus. But invariably, the president strays off message, and today he used the forum to rail against what he described as congressional obstruction in the confirmation of government officials, and threatened to adjourn Congress and then push through his nominations during the recess.
The Senate should either fulfill its duty and vote on my nominees, or it should formally adjourn so that I can make recess appointments. We have a tremendous number of people that have to come into government, and now more so than ever before because of the virus and the problem.
It's a threat against Congress that no president has made before.
Perhaps it's never done before. It's never been done before. Nobody's even sure if it has, but we're going to do it. We need these people here. We need people for this crisis, and we don't want to play any more political games.
Many in Congress would view this as an attack against the fundamental principle on which this country's democracy is based, a system of checks and balances that separates the powers of the executive, the judiciary, and the legislature. It's the latest in a series of actions that would appear to amount to an abuse of executive power, and follows the suspension of funding to the World Health Organization that Congress had already approved, and the insistence that the president has the right to order states to follow the guidelines of the executive in deciding when to lift the mitigating measures. President Trump says he'll speak to governors before announcing new guidelines Thursday, making clear these involve the easing of restrictions in a number of states.
You already know we'll be opening up states, some states much sooner than others, and we think some of the states can actually open up before the deadline of May 1st, and I think that will be a very exciting time indeed.
The president ended the briefing with these words.
Big day tomorrow.
On this day's evidence, it's not clear whether this is a promise or a threat. Mike Hanna, Al Jazeera, Washington.
Denmark is allowing primary schools and nursery schools to reopen, making the first European country to lift the restriction against the coronavirus on education. It was also one of the first in Europe to impose a lockdown, but not all parents agree with the government's move. Al Jazeera Simijan reports from Kapihanjing.
A long-awaited reunion. A school principal welcomes back his students after a whole month.
I have really missed my school, and I'm excited to meet my teachers and friends.
To see them again is a very, very big pleasure.
But much has changed. Social distancing is still required, and parents are no longer allowed to drop off their children inside the school.
Worried about the kids in the virus right now, so I'm happy, but I'm worried at the same time.
However excited the kids are to see their friends again, hugging is not allowed. Instead, they have to wash their hands
around and round
properly.
Now you're ready.
And sit in the classroom 2 meters apart, which requires spreading the children to more rooms.
Been out hiring young students to come in and supply our normal staff to have enough staff.
Apart from schools, nurseries are also opening today, but only half of them are ready to welcome kids due to the new health requirements with extra cleaning, less furniture and more outdoor classes. The rest will open in the coming days.
The kitchen is closed, it says. This used to be the kitchen area for children having breakfast in the morning. It's only kids under 11 years old who are back at schools in Denmark. The rest are still at home. And these are the lockers for the kids. Their jackets and shoes are here, but they're no longer allowed to be here in order to avoid them standing too close to each other.
While the children here are happy being back, others are at home. Thousands of parents are refusing to send their kids to school.
I'm responsible, not the state, not the kindergarten, not any. I'm responsible.
Catherine will keep her children at home from nursery and school for the next few weeks, perhaps months.
Oh, I'm worried about the virus, of course. And we've been protecting our kids for the last months, like mad, and now they're supposed to go ahead of it all. And I'm also worried about the scenario they'll meet based on fear and distance, which is not natural for a child.
Back at the school, it's time for a short break.
Don't get too close to each other.
But the children are only allowed to play in small groups of 4.
I feel bad for the kids because they want to play together and they are not allowed to play together.
Simi Jan, Al Jazeera, Copenhagen.
Medical workers in some parts of the United Kingdom are starting to run out of personal protective equipment, PPE. That is despite the government saying there are enough PPE and those who need it most are getting it. With the growing number of healthcare workers infected and dying, many are now improving to keep themselves safe from COVID-19, as Azila Jonah Health reports.
Adil El Tayyar, a renowned surgeon with many years' experience in the National Health Service. Donna Campbell, a healthcare support worker who could light up a room with her infectious laugh. Just some of the UK health and care workers who've lost their lives to COVID-19, often for want of proper protective equipment.
My basic understanding of infectious disease is increased exposure equals increased risk of contracting that disease. And as key workers, as healthcare workers particularly, we are at increased risk of exposure because we are working with people who have coronavirus every single day. And without the right protective equipment, then there will be people who die because of being at work.
Every Doctor is a non-profit organisation run by doctors campaigning to keep health workers safe, as well as highlighting how far behind other countries the UK is in the provision of protective equipment, or PPE. Every Doctor hears daily from medical staff forced to use improvised methods to keep themselves safe. This is happening months after concerns about coronavirus were first raised by health workers in the UK, and despite repeated government promises that items of PPE have been procured in their hundreds of millions and are being widely distributed. As Britain nears the peak of its epidemic, dangerous gaps remain.
Well, I'm sorry if people feel that there have been failings. I'll be very, very clear about that. But at the same time, we are in an unprecedented global health pandemic right now.
Critics called the Home Secretary's apology half-hearted, and the Public Services Union Unison says the time for excuses has passed.
Well, we're continuing to see significant problems with the supply of PPE in social care. Social care staff are still telling us that there are major shortages. We've had some members telling us that employers are refusing to let them wear face masks.
To help close the gaps, this group of London-based entrepreneurs has pitched in 3D printing visors for NHS hospital staff.
I was inspired by one very sad story about Norfolk Park nurses who are using bin bags to protect themselves. So using 3D printers behind us, we're able to manufacture this face shield. The face shield can be 3D printed in just under 2 hours. And using just some simple elastic and acetate sheet that has been laser cut, we can ship these out directly to hospitals that desperately need them.
There will be a time for answers, time to ask who failed, how and when. But for now there is only reality to cope with. Health workers in hospitals and care homes across the country short of basic protection as they tend to the sick and the dying, and in some cases having to decide whether saving a life is worth jeopardising their own. Jonah Hull, Al Jazeera, London.
And before we end the news, a recap of our main headlines. Additional 5 people in quarantine, reveals Permanent Secretary at the Ministry of Health. Gambia biggest GSM operator AfriCell to pay health frontliners for 3 months in the fight against COVID-19. United Nations Population Fund donates motorcycles to the Ministry of Health in their efforts to fight COVID-19. IMF says Nigerian economic shrinked by 3.4%. Trump says virus caps to be lifted in some states as cases peak. Denmark eases restriction to health virus for schools. That's all for this edition of the news. Please enjoy the rest of our programs and join us for tomorrow's news. Thank you.